We asked a group of students how many tries they thought it takes for a woman to get pregnant. If you think you know the answer, see if any of our students' responses match yours.
How many tries do you think it takes to get pregnant?
One. Just one.
It depends on the person or the people, really. I mean, so many people get pregnant by accident and so many people try for such a long time, so lots of different factors.
I would say on average it could take a few months. I mean, I think it probably takes about 6 months, but obviously there's people that could get pregnant on the first try.
It could be one.
Could be one.
I don't think it's a set number.
There's just different factors that go into it, isn't there?
Yeah.
There. Once is enough. It's
Could
good.
be twice, could be 3 times.
Yeah.
I don't know.
Over 80% of couples where the woman is younger than 40 years old will get pregnant within a year of trying. That is, when they're having regular intercourse and not using contraception. Clinically, a couple are considered infertile if they fail to get pregnant during a year of unprotected intercourse. This doesn't mean they can't get pregnant, but should be a trigger for investigating whether there's an underlying problem. Male and female problems contribute pretty much equally to problems getting pregnant. In about another third of couples, either the problem can't be identified or both partners have fertility problems. Infertility in women is mostly explained by 3 problems. Problems with ovulation, meaning that the oocyte doesn't get released. Problems with the oviduct, known as tubal factors, meaning that sperm and oocyte don't meet. And problems with the uterus or peritoneum, preventing the embryo implanting and developing normally. Let's look at these female fertility problems in a little more detail. Ovulation. Failure to ovulate is the most common female cause of infertility and occurs in about 40% of women who are having problems with their fertility. If an oocyte isn't ovulated, then it won't be present in the tract and able to be fertilised. Sometimes women don't ovulate, or only sometimes ovulate, because of problems with the ovaries themselves. For example, women with few oocytes, as happens in ageing, are less likely to ovulate. Conditions such as polycystic ovarian syndrome or PCOS also mean women may either not ovulate or not ovulate regularly. In many women with PCOS, oocytes start to grow but do not finish developing or ovulate. Their ovaries contain many follicles below the surface, sometimes described as looking like a string of pearls on ultrasound. You can see the multiple follicles inside this ovary from a woman with anovulatory PCOS, where ovulation doesn't occur. Finally, anything that disrupts the hormones that control the development and maturation of the oocyte and trigger ovulation from the ovary will impair ovulation. This includes some modifiable factors such as obesity. Reducing weight by as little as 5% can restore regular menstrual cycles and ovulation. Tubal factors. This type of problem happens in about 1 in 5 couples who are infertile. If the oviducts are blocked, oocytes are not able to move from the ovaries to the uterus, and sperm is not able to reach the oocyte for fertilisation. Some women with endometriosis may develop scarring in the oviducts, and damage can also be caused by STIs. Untreated gonorrhea and chlamydia in women can lead to pelvic inflammatory disease, and in turn to scarring that blocks the oviduct. Uterus and peritoneum. These are less common problems than ovulation failure or tubal infertility. Some women are infertile due to problems inside the uterus, such as scarring or fibroids. Scarring can make it harder for an embryo to implant in the lining of the uterus, the endometrium. Large fibroids inside the uterine cavity can physically change the shape or position of structures or interfere with blood supply to the uterus. External scarring and adhesions, literally sticking together of tissues, as happens in severe endometriosis, may disrupt the positions or functions of reproductive organs too. As well as problems that prevent fertilisation or implantation, couples may take longer to have a baby if they lose their pregnancies early on. Poor embryo quality is likely to lead to early pregnancy loss. This is a particular problem in older women since damage accumulates in the oocytes remaining in the ovary. This means that the risks of major genetic problems increases in embryos from older women. And these embryos often fail to develop and implant or are lost early in pregnancy. Next, you'll find out more about some of the issues associated with female ageing, fertility, and early pregnancy loss or miscarriage.
I'm Dr. Dee McCormack. I am a senior obstetric consultant at Women's and Children's. I have a major research interest in miscarriages and run about 3 clinics a week looking at couples who've suffered miscarriages in the hopes of finding causes and treatments for these couples. A miscarriage is the unwanted loss of a pregnancy before the baby could survive outside of the mother. So the actual time the baby could survive depends very much on which hospital they're at. So at a tertiary hospital, that's often from 22 weeks and 6 days, but at some other hospitals it could be as late as 24 weeks. If the pregnancy is delivered before then, it's classed as a miscarriage because the baby cannot survive. Whereas a stillbirth is a baby that has died before birth that could have survived if they had still been alive. So in our hospital, 22 weeks and 6 days. If they're born at 24 weeks, or if they die at 24 weeks, it's classed as a stillbirth. It can happen any time from conception right through to viability. Quite commonly, it happens immediately after fertilization. With some of the very sensitive pregnancy tests, patients are able to detect that and decide that they're pregnant before they've even missed a period. In the years gone by, before the pregnancy tests were so sensitive, they would not have known about that pregnancy and they would have just thought they've had a late period. They used to divide miscarriages into first trimester, which is in the first 12 weeks, or second trimester, which was from 12 until viability. Nowadays we talk about embryonic, which is from fertility till about 10 weeks, or fetal, which is from 10 weeks onwards, more for research purposes than for any other definition, just so that when we do research, we're all talking the same language. Miscarriages are very natural. They are things that nature decides that this is not a healthy pregnancy. There is something wrong with that baby and just basically doesn't allow it to continue. And truthfully, probably in the region of up to 50 to 60% are genetic abnormalities that cannot survive. Not necessarily. If it happens between the fertilization and implantation, she may have no signs at all unless she's done a very sensitive pregnancy test. Occasionally it can manifest as just a late period or a slightly heavier period. Usually after that, if the period is late, they've done a test or they've had a blood test, then they will probably know because they'll get increased bleeding, possibly a bit of cramps. So the later it goes, then the bigger the baby has been and the more obvious it becomes. So any bleeding in pregnancy is a warning, but not necessarily bad news. There are many other reasons for bleeding that's not necessarily meaning that it's going to be a miscarriage, but it is worth getting it checked out, because if they come into an emergency department, we can at least check up and make sure that this is just one of the unknown bleeds, or we can actually say, look, this is not looking good, let's make some further plans. So miscarriages, there are many so-called risk factors. It's a very hard area to look at and even to research, because for a lot of the time we just don't know. The things that we worry about are lifestyle factors, and of those there are many: smoking, definitely, obesity, people who are doing drugs or not having a very good lifestyle, alcohol, certainly the bad lifestyle things are risk factors. Having said that, there are many people who do that and have perfectly normal pregnancies. So the serious genetic ones, probably the commonest cause is age. No matter how fit and healthy a woman is, certainly from the age of 35 onwards, the risk shoots up and there's very little that anybody can do about it. Even IVF battles with that. Maternal age is a very important factor, and we now understand that paternal age and frequently his lifestyle habits as well can influence the quality and how a pregnancy progresses. So lifestyle factors for both are important. once the patient has had certainly at least 2 or more documented miscarriages, preferably with the same partner, we start to consider that as being a little bit more serious, and that's where we would like them referred to a clinic that specializes in arranging the tests for both partners. So many times when the patient has the first miscarriage, they're pretty shocked, but they get over it because everybody says, oh, it's very common. When they have a second one, it's quite lifestyle changing, and many of them will go straight onto the internet and start reading about vitamins and start improving lifestyle and actually alleviate many of the problems by themselves. Once they come to clinic and we confirm that they are indeed proper miscarriages, that there's no major lifestyle factors that can be immediately changed, we will then institute a workup, and depending on what we find, we will suggest treatment for anything, if we detect anything that could be contributing. But it's very difficult because it's a very heterogeneous thing. It's huge. There are many potential causes, very few documented real causes. So you've got to be really careful that you don't sort of start advising patients to do really strange and dangerous things. So one of the most important things is a really good history, a really good examination of the lifestyle and factors that could be contributing, and just relaxing them and saying, look, this sometimes happens, it may have been genetic, just relax and let's see what we find and go from there.